Today I'm talking about hip pain. Now maybe you have hip pain and your concern is that your pain could be arthritis or some other joint problem. So in today's video, I'm going to explain everything I can about hip pain. So by the end of this video, you can leave it knowing exactly how to test and what you can do about it to help relieve some of your pain. Quite often people come in saying they have hip pain and their concern, maybe like yourself, is that it could be something to do with the joint. But there's three places that people often say they have pain. So if I just show you on my spine, so this is a human spine. As you're looking at it right now, this is the front. So the stomach would be here. This is my right side. And then as I come around this way, this is towards the back. So people will either feel pain towards the front side of their hip, the outside, or towards the back in towards the sort of buttock region. Now, this is kind of the structure of the hip joint. So this here is the socket. This is where your hip joint is. So it's known as a ball and socket joint. So if I put that down and pick this model up instead, this is a hip joint. So this is the right leg. So as you're walking, this is how it would look. So as I come, this is the outside here. So as you're walking, this is how it moves. So this is your pelvic bone here, this is the front, and this is the outside. As you can see, there's a lot of movement that can happen through this joint. These blue structures here, this is called the joint capsule or the labrum. So the labrum is just in there and then the joint capsule goes around it. All of these red markings that you can see here, this is where the muscles start. This is where muscles start from, and then they come down and attach to where all of these blue markings are. So as you can see, there's a lot of muscles that attach to the femur, your thigh bone. So if we just talk about the three different locations that people feel pain, the first is at the front. There's a few different things that can happen if you feel pain at the front. This is where you would most likely feel pain if you had a joint problem, such as arthritis. So just to clarify, that would be more towards into the groin. So as you're looking at me here, that pain you would feel in the groin. So if you have groin pain, there's a chance that it could be joint related. If it's not, then it could be your joint capsule or the labrum that goes around the joint itself, or it could be your hip flexor muscles. So you've probably heard the term hip flexors a lot before. Not many people actually know what that means. So I've now added in the hip flexors. So you're still looking at this from the front. So this is still the right side here. This is the inside of the pelvic bone. And just to be clear, that's here. So that's inside of this here. So the muscles that we commonly refer to as the hip flexors are two muscles collectively known as the iliopsoas. So it's made up of two muscles. One is the iliacus and the other one is the psoas. Now this muscle here actually comes up and attaches onto the spine, but it's obviously been cut. So this muscle comes down and attaches to the inside of your thigh bone just here. So it's quite common that if you have a hip flexor strain or any other muscles on the anterior side, so the front side, that can cause you groin pain. So if you feel pain at the front, that could be muscle, it could be the joint capsule or the labrum, or it could potentially be arthritis. Now the second place that you could feel pain is more towards the outside here. So if I show you on my model again, you could feel pain on the outside of the hip. Now, whenever anyone comes in saying they have hip pain and they tell me it's on the outside here where this bony bit is, you can feel it. As you run your hand down, you can, so there's pelvic bone there. As you bring your hand down, you can feel a bump, a bony bump. That's this part of the bone here. So anytime someone comes in, they say they've got hip pain and they refer to this outer part, I know for a fact that it's not the hip joint. What it most commonly can be is a tendon or a bursa. So just to clarify, if I add in some of the muscles, so now I've added in your glute these are called, people refer to these as glute muscles. So these are your gluteus minimus and medius. So there's two muscles here. As you can see, they take up quite a lot of space. They come down and attach to the outer part of this bone here. So now you're looking at it from the back. They attach to this outer part of the bone. Now, people can be very tight through these muscles. This is primarily due to just the way we move. We're always sitting, or we just very rarely stretch out these muscles, so we can get very tight. And then something happens, such as a repetitive movement. Let's say you've gone for several long walks in 1 week, or you've started training and you started doing more running, or you've just generally just started moving or even stretching more than usual. Whatever it is, it tends to be that you've done more of something. People will then feel pain around this outer part. So you're looking at it right now from the back. Quite often people can feel pain anywhere from the back part to the top part of this bony bit round towards the front. So it tends to be this whole kind of semicircular area. So where these muscles attach, this is tendon. Now obviously it's red here, but tendons have a more of a whiter appearance. So I see quite a lot of people with pain here. Moving further around to the back, so this is now still the right hip, and you're looking at it more from the back side. You can see that there's now more muscles that I've just added. These muscles are your rotators of the hip, so they help to externally rotate your hip, your thigh bone. Again, many of these attach to the thigh bone, and they can also become very irritated. There's also a nerve that comes out here and runs down the back of your thigh. This is called the sciatic nerve, and this can become very irritated in people as well. So people with sciatica have an irritation of this big thick nerve. This muscle here is called the piriformis. Many people have heard of the piriformis. Anytime they have pain in the backside, they say that that could be because it's their piriformis is in spasm, or the sciatic nerve is being pressed on by the piriformis. And yes, that can be true. The sciatic nerve comes out around here, but it could be that, but it also could be any of these other muscles that come around this area too. So it might not just be that piriformis. Anyway, regarding hip pain, I'm not going to talk so much now about the back side of the body. We're only going to focus on the outside and the front. So now I'm going to show you a couple of tests that you can do just to differentiate between hip joint or muscle and tendon. So the first thing you can do to test if it's your hip joint is bring the bad side foot. So if it's my right hip that's causing me pain, I'll bring my right foot up above my knee, and then with this, the bad side knee, I'm going to drop it down towards the floor. And what we're looking for is either pain through the hip joint, or for the knee to be able to come almost parallel to the floor. If you're finding your knee is up here, or it's causing you pain from anywhere from this point to horizontal, then the chances are that it could be your hip joint itself. So now if we want to test whether it is the soft tissues such as a tendon or hip flexors, so we bring the good side up towards the chest, and what we're looking for here is, does this bad side, the leg that's straight, is that lifting up off the floor? If you're bringing the good knee up towards the chest, and then you're seeing that this knee is lifting off, then that indicates that there's a shortening of the hip flexors. So that could be spasm, or it could be just some kind of overall muscular tightness. So ideally you want to be able to keep your knee down as you bring your good side up towards your chest. So now if we move on to the side of the hip, one of the most common tests that I use on people, and you've probably seen this in some of my other videos as well, is this one here. So if you're sitting on a chair, bring the side that you want to test up. So bring this foot up, place that on your knee. And what we're trying to do is to see how low this knee can drop down. Now this in itself is difficult for many people. Some people haven't even got the flexibility to bring that foot up onto their knee, in which case it's highly likely that the pain on the outside of your hip is due to muscular tightness. If you can get into this position, then push your knee down as far as it will go. What we want to be able to see is to get that shin bone horizontal, get that parallel to the floor. So if you do have pain in the outside of your hip, this would most likely cause you some discomfort or a sense of stretching. And of course, the other thing we can do is just simply press into the bone or just above the bone. Quite often when I do that, that's very tender in a lot of people. That tenderness simply just means that there's inflammation or tendonitis. There is a possibility that it could be some inflammation of the bursa as well. It doesn't matter whether it's the tendon or bursa. If you're pressing there, it's causing pain. The point is that the muscles above are too tight and need to be relaxed. So as well as that being a test, you can also use this as a stretch. If you can get your leg up here, then that's great. Hold on to your shin to stop your foot falling off your knee. You can either use your hand to push that knee down, or you can use your elbow. If you want to intensify that stretch, then what you can do is lean forwards. Also, what you could do is adjust the height of your seat. The higher the seat is, the less intense that you're going to feel it in that hip. As you lower it, you're starting to bring this knee up, so it causes more movement through that hip joint, and so you'll feel that stretch is a lot more intense. If you're using this as a stretch, I would hold for 20 seconds and build it up to 60 seconds over time. You could do this every day as long as it's not causing you pain. So for example, if you're doing it every day and you're feeling like the pain is getting worse, then just ease up. Do maybe every other day and see how that feels. If it's still painful, then just maybe once or twice in the week, but you want to just keep that joint moving, keep those tendons moving, because through here there's going to be inflammation. So the last thing you want to do is repetitively move those tendons or put load through them. So keep everything very minimal in terms of the amount of movement or the amount of stress, but keep them moving. So cycling on a stationary bike with very low resistance can be really beneficial. Swimming or just walking, but for no more than 30 minutes at a time. So if you want to stretch your hip flexors, or you want to stretch the muscles at the front of your hip, let's say you are able, let's say you're able to kneel down on the floor. What you're going to need is a towel, unless your floor is padded, but mine is obviously a hard floor, so a towel. The hip that you're trying to stretch, that knee goes on the towel. From there, the good side, you step forwards. Now this bit's really important. With your hips, what you don't want to do is be sticking your bum out, because that's going to shorten this muscle and it's going to take away that intensity. So start kneeling on the floor, tighten up your abdominals and tuck your tailbone underneath you. It's like you're trying to push your hips forwards. So keep that tension through here. Don't let anything slack off, and don't let your hips, don't let your bum stick out the back. So tighten up here, big step forward with the good side, and then lunge forwards, keeping that tension through here. What you should feel is a stretch going through the front and possibly down the thigh. Is just the quad muscle stretching, and or the tendons up here of the hip flexors. So I would do that for 20 seconds. Over time, you can build that up to 1 minute. I would say do that every other day. That's quite an intense stretch. So the last thing you want to do is push that too much and cause any more tendonitis. So just to reiterate, this is for your hip flexor muscles. So if you have any sort of joint pathology, such as arthritis, this is not what you want to be trying to do. You want to be only doing this to stretch the muscles, the hip flexor muscles. So if you find that you can't do that stretch kneeling down because it hurts your knees, you can do this standing up. Find a wall just for stability, and the side that you want to stretch, Take that foot back as far as you can. Now you can keep your heel off the floor. You don't have to have it fixed onto the floor because you might not have the flexibility in your calf or your ankle. So either heel up or heel down, doesn't matter. From there, just holding onto the wall, tuck your tailbone under, engage your abs, and then push your hips forwards. So what you're not doing is leaning back. You're keeping your spine nice and stable and just pushing your hips forwards. So from here, you should feel a bit of a stretch through the top of your thigh, maybe into your groin, but you shouldn't feel any pain or compression through your spine. So again, abs tight, bum squeezed, hips forwards, and hold. So now that we've been through those stretches and been through those tests, hopefully you have a better idea of what could be causing your hip pain. So my suggestion is go and try those stretches, go and try those tests, stick with those stretches. If you decide that it is muscular that's causing your problem, then stick with those stretches for at least a month, maybe every other day for at least a month. As it starts to improve, the next step will be to start to strengthen it. And that will be something we'll touch on in another video. But in the meantime, if you do have anything like back pain or you want to see some more hip stretches, then go and have a look at these videos that I'm showing you on the screen right now. So stick with it and I will see you in the next video.